Hi folks, my name is Scott Campbell. I'm a physician here at the hospital in the emergency department. I'm a board certified emergency physician. And recently I took on the job of Chief Medical Officer and Vice President of Medical Affairs. It's been about a month now, and I've been asked to come to the speakeasy and tell you a little bit about myself. So I'll start out with that I'm from Akron, Ohio, born and raised there. My wife's from Sandusky. We have two boys, Austin and Sebastian, 23 and 24 years old. I came to Firelands in 1992. So before that, I'd actually gone to Adrian College, which is in Michigan, just over the border. Went to the Medical College of Ohio for my medical school, and then I went on to St. Vincent's Medical Center in Toledo through the Emergency Medicine Life Flight program. Around the end of my residency was doing life flights over to the islands here, picking up patients, bringing them to the emergency room. As I ran into some of the docs that were working here, they offered me a job, and I came here in 1992, and I liked it so much I haven't left yet. So at first, like every other ER doc, I wanted to just work my shifts and go home, which is what I did for quite some time. As I got a little older, started going to some meetings, started getting involved in a little bit of administrative things, getting a little more interest in that. And then about 10 years ago, I took over as the director of the emergency room and became the president of ER Doc Incorporated. That group is independent, so we're contracted by the hospital to run the Department of Emergency Services, and nicely we've been doing it for about 3 decades now, so we continue to be a contracted group here with the hospital. So this CMO role that they have put me into hasn't been here at this hospital before. Some of you may have read that. We've never had a chief medical officer, and the idea behind that, and there's many hospitals that have this role, and depending on what kind of hospital size you work in, there's different roles for a chief medical officer. I look at my main role as being a physician liaison between the physicians and the rest of the administrative staff. So I've kind of got one leg with the physicians and one straddling over to the administrative side. Try to see what the physicians need, be able to voice a physician's input into administrative things. They wanted me to be on certain committee meetings, strategic planning for the hospital, where there really in the past had never been a physician's voice, and maybe looking at how the physicians would view things in those meetings that maybe make the operations of the hospital work a little better, and then make this more seamless between the two, because in the past it hasn't always been seamless. And so I think that's my main duty as the chief medical officer. There's going to be a lot of other things. Right now I'm just kind of learning and trying to figure out where I fit in. There's a lot of senior leadership here that does a lot of things really well, and they don't need me to get in their way. So I'm trying to listen and see where I might fit in, where I might be able to make things better from a physician standpoint, where physician input can make things work a little better here at Firelands. I'll be getting into other things such as strategic planning at the hospital and how that interact with other physicians, maybe in the hiring process, retention of physicians, and whatever else they decide I kind of fit into that maybe is in my wheelhouse. I have some background obviously in the emergency room and behavioral health, that kind of thing, where I might fit in as well. So bottom line is, this is a new job for me. This is a new job for the hospital. We're going to try to mold it, make it into something that's good for everybody. I'd like to say that in a year, the physicians look back and say, you know, that CMO job was a pretty good decision on the hospital's part. We think that was a good idea for the physicians, and it has worked for all of us. And then I'd like the administrative side and the staff and the people in the hospital to say the same thing, that they can look back and say, you know what, I think this was good for Firelands. This was a role that was needed here. And then as I go forward in the job, we can make it a little better each year as I figure out where I fit in. So thanks for listening. I appreciate you taking the time, and have a good day.